people have been just terrific about this. We're all at a heightened state of anxiety, and yet people are showing their caring in so many different ways. The outpouring of support that many of us have gotten, I've gotten many phone calls from friends, from neighbors. We get letters from strangers just expressing their appreciation. I can't tell you how much that means to us. The hours are longer, the stress is higher, and it really is meaningful that people do that. So we are so grateful for that. People are showing their desire to help in wanting to sew masks, in food donations, in all sorts of different ways. And it's just been really gratifying to see that. It's heartwarming to see those signs, to see people with white ribbons walking around and tying. I've seen people tie white ribbons on their trees outside their homes and putting those signs in their apartment windows. It really means a ton to us that are doing the best we can for our community and helping that community to stay healthy and care for them. And to see that sort of outpouring of appreciation is just, it's been terrific. Yeah, and they're so needed. I mean, and it's great that our medical students are doing that. Our medical students, unfortunately, are not getting the education right now that they're normally supposed to be getting for their protection and the protection of their families. And so they're finding a way to help the community in a different way. And it's great to see them doing that. And the community's been really responsive in helping us. Personal protective equipment's a big deal for us, and it really determines how much care we can provide. And so we want to make sure that we're not running out of those today, tomorrow, and certainly looking forward into the future if things heat up here in Utah. Yeah, so there's a lot of different curves, Scott, and all of those are predictions based on data. And so we look at a curve and it says, well, there's going to be a surge in need for healthcare later in April. I've seen curves that are peaking in June, and they peak at different levels and they peak across different shapes. Some are broader, some are more spiked. There are curves that actually show spikes or peaks even in July or later. All of these are valuable predictions. They are put together by people a lot smarter than me that are putting these together, but they differ because of the different data that goes into them. And it makes it obvious. It would be great if all of the models predicted the same thing. Believe me, my job would be a lot easier, and it would be for all of us. It's a little bit like predicting the weather. If everyone says it's going to rain tomorrow, it's probably going to rain tomorrow. But if one person says it's going to rain tomorrow and another meteorologist says it's going to be cloudy, another one says it's going to be sunny, and another one says it's going to hail or snow, we don't really know what it's going to do tomorrow, and we have to be prepared for all of those different things. And that's what we're doing here at University of Utah Health. We look at all of those curves. We have people that are tracking them and actually feeding input into them and generating their own curves. But at the end of the day, we're really trying to be prepared for all of those eventualities. As time goes on, as we get closer to, tomorrow, we know the curves come together. But it's in the 2 to 3 months from now, like a weather forecast, where there's going to be more divergence. Yeah, so that's a really good question. We're all looking at that, and so we're trying to prepare. The job is fun, right? Because 1 hour I'm in a meeting where we're preparing for some sort of medical Armageddon, and to be ready for that, and then we're also preparing for back to normal in the next hour. And both of those are futures that may happen. Now, obviously, we're going to get back to normal. We're going to be okay, and we're going to get through this. How quickly and how that happens, we don't know yet. We can talk about that. The Armageddon is looking much, much, much less likely. We still need to maintain all the things that we're doing as a society, all the great things our citizens are doing in physical distancing and keeping one another safe. And that then flattens that curve and makes it less likely that we're going to outstrip our resources. But we all want to know what's going to happen in the future. Unfortunately, these curves don't predict the future. They just talk about what might happen, and they don't make it happen. If I say it's going to rain tomorrow, it doesn't mean it's going to rain tomorrow. And so getting back to normal is something we want to do as a society, clearly, and also we want to do that in our part in healthcare. We want to provide healthcare to patients. We want them to come in for their elective surgeries. We want them to come in if their pain isn't so severe they have to come in because it's an emergency, but bad enough that it's affecting their quality of life. And so those are things we're looking at. We're thinking of it not so much as an on and off switch, but as a dial, or dialing things up and dialing things back. And what we're seeing in other communities around the world is as you dial up, sometimes the virus levels go up because we're interacting more with one another. I don't want to maybe overemphasize this too much, but literally what people are doing here in Utah it's saving lives. And we need to remember that. It's inconvenient and it's economically devastating, and we're all very much aware of that. And so that's why we're trying to find that dial where we can dial up enough to say, let's get people back to work. Let's get people out socially again. People are lonely and isolated. But let's not do it such that things take off. We've seen a 100-fold increase in our telehealth abilities when our IT team, our information technology team's just done a great job with that. We have tried to expand out telehealth as rapidly as we can. And for everything that we can do by telehealth, we want to do it that way. We want to keep patients at home. We don't want, and again, that's part of that physical distancing. When we see patients here in the hospital, especially if they have a fever, a cough, or things like that, then everybody's got to put masks on, and what happens is we burn through that personal protective equipment, or that PPE. And we want to reduce that. We want to save that for down the road in case we need it. And so we want to do as much as we can through a video chat. If people are more comfortable with a phone, we can do that. If we need to have you come in, doggone it, we're going to have people come in. There are just some things we can't do over the phone. It's hard to listen to someone's heart and lungs through the phone or by video. But those are the things that we're going to try to do as much as we can by telehealth. And we want to provide as much care as we can right now during this time in that format. And whatever we can do, we'll do. So I think that really staying physically distant from one another. People have called this social distancing, and I prefer the term physical distancing because we still want to interact with one another. But the idea of staying 6 feet apart so that if I cough or sneeze, that's not going to hit you. Or if you cough and sneeze, it's not going to affect me. We know that that's how this virus is spread, is either through respiratory droplets being sprayed out, or if I touch my eye, my nose, my mouth, get those respiratory droplets on my hand, I touch your computer and then you type and then you touch your eye. And so that's how those things are happening. So that physical distancing is really important. When we're not able to be physically distant, masking is important. Now, a couple weeks you and I talked about how masks were not as important because we were thinking of them in terms of, I'm going to put a mask on so you don't get me infected. But we're changing the way we're looking at that. And really, I'm going to put a mask on so I don't infect you, even if I don't have any symptoms, because we now are understanding that people may be able to transmit this virus the day before or a couple days before they really have that fever, muscle aches, shortness of breath, coughing type of flu-like symptoms. So even a cloth mask is helpful in that way because it's going to keep those respiratory droplets. There you go. Again, that's the community that we live in, and that's what makes it wonderful to be here. And so that's sort of an idea, and you can make that a fashion statement. It doesn't have to be a white mask. It doesn't have to be a paper mask. But we can wear masks that complement your tie today. But whatever that is, that's going to help so that when I go to the store, I'm not spreading it to everybody else. Now, if all of us do that, we're keeping one another safe. And that's a great way that we can show our citizenship, our care for one another. This is a question that's come up, and we are having these conversations with our healthcare workers who might be exposed. Let's say I'm working with a patient who has COVID-19 here in the hospital. I'm going to be doing that. I'm going to be wearing scrubs, and then I'm going to be taking those off in the garage, or if you can change before you leave, maybe don't change in the carport necessarily, but if you can change before, as you leave work, before you get in the car, that's probably a reasonable thing to do. One of the things that we don't really fully understand is how often we touch our eyes and our nose, how often we brush against something that someone else has brushed against. And so again, I think we want to be reasonably cautious about things like that. I don't know that it's necessary to wear disposable clothes and burn your shoes and things like that, but Bonnie, not a bad idea if you're in an area where you're concerned about you're going to be infected. The level of community spread that we have here in Utah, the number of people that actually have the virus is pretty darn small, and so we don't think that the risk of us giving one another the virus because we touched a piece of fabric and then a day later someone else touched it, those odds are really, really small. But it's something that it doesn't hurt to be cautious about. And if I'm an 80-year-old person with some lung problems, I'm going to be much more cautious than a 20-year-old. That doesn't mean 20-year-olds can't get it. It just means that the effect of the virus differs in folks. We do have, unfortunately, young people that are severely affected by this, and we have young people that are dying of this in our country. So no one's completely immune from this, but certainly being extra careful, important for select populations. Great question, Bonnie. People want to do takeout because they're helping the economy by doing that, right? And at the same time, we worry about it. I would say takeout is as safe from coronavirus as it is from anything else. And so meaning it's safe. That if someone is going to get takeout, again, if you want to pour the takeout onto a plate, let's say it's in some sort of a container, you pour it onto the plate and then throw that away, wash your hands before eating, that's going to help you to be that much safer. But I would say, by and large, yes, takeout is safe. The soap's more important than the water. Warm water is probably better than cold water. So if you can, Bonnie, use the warm water. But if you can't, if you're in a hurry, I'd rather use the cold water and soap than nothing at all.
Because sometimes you go places and you can't even get hot water.
Right. You go out. Right, and then alcohol-based hand sanitizers are a great option as well. I think that is the most important thing we can do, Scott, to relieve the burden. And I would say stay physically distant, but socially close. Check on your neighbors, check on your family, and stay connected, but do it in different ways. Do it through video platforms, do it through the phone, do it, go for a walk, stay 6 feet away from one another. If there are things that we can do to slow down the spread of that virus, that's what we can that's probably the best thing we can do for our healthcare systems and for our society. Yeah, so absolutely is safe. As you talk to a blood donation place, they're going to ask you about any risks that you might have, because obviously if I've got coronavirus in my blood, I don't want to give it to you. And so that's another thing that it would be extraordinarily rare to happen, and that everything's being tested to make sure it's safe. And so blood donations are down as a matter of social distancing. People just aren't going out and donating blood. And so, but yet the need is still there. As you mentioned earlier, life goes on, and other healthcare situations still go on. And so we want to make sure that we can address that. Another thing that people are asking about is plasma. So in other words, if I've had coronavirus and I've now recovered from it, can my plasma be used to treat other people? This is an area that's being actively researched right now, and we are setting up to be able to look into that and do that here at the University of Utah. I was on a call earlier this week with our colleagues in Korea. They're just beginning to get into that as well. And so Again, that would be a treatment for someone that's in the hospital, very, very sick. Could my plasma, my recovered plasma, then be used to treat somebody else? And another way that we can give back as a community, and all that's being looked into right now. Theoretically possible, highly, highly, highly unlikely.
Yeah.
And so, it's possible, like I said, but that's not, can we get it from our grocery items? Can we get it from takeout food? Could we get it from our shoes? Theoretically, all of those answers are yes, but the likelihood is that I'm going to get it because I'm standing 2 feet away from someone who sneezed, because I'm standing too close to him or her in line.
Yeah.
And so, or I'm going to wipe my eye and I'm going to shake hands with someone. Or those are the ways that are most likely for people to be getting this. It's a great question. Let's go back to those surge curves that we're talking about. We know that a coronavirus is the same type, this coronavirus is the same type of virus that we see with colds. And so there is some possibility that this could become seasonal. We know that in some viruses, the warmer weather, the warmer surfaces, the humidity changes, it actually makes it harder for the virus to be transmitted from person to person. Whether that will be true of this virus, ask me in about or ask somebody smarter than me in about 3 or 4 months. We don't know. But we're getting more and more information. We're trying to get that information from the southern hemisphere, who's going through a different weather, right? The exact opposite. They're heading into winter as we're heading into summer. And so more information on that is coming out. We just don't know the answer. Is it possible that coronavirus could be with us for a longer time? That it could actually draw out, that the curve would never drop back down to zero, or at least wouldn't, I should say never, but wouldn't for a number of months, possibly into 2021. That is possible. And we may be having coronavirus at a very low level. We're seeing this in places like Korea right now, where they have, as a country, a very low level, but it's a rather constant drip, drip, drip every day of coronavirus. What does that mean for us as a society? Things might change for us a little bit. We might be doing masks for a little while longer than just the next couple of months. We might be more attentive to cleaning surfaces and washing our hands and doing things like that in order to reduce the spread. But again, these are all things that are being predicted based on models and assumptions that we don't know the answer to. At University of Utah Healthcare, we are planning for that eventuality as well. What would it look like if we always had coronavirus at a small level, or if we had it for months to years? We can't put off people's pain and suffering forever. And so we're looking at all of those eventualities. Great question, Stephen. Thank you. No, it's not inevitable. So the things that we've just been talking about, we can do within our own homes. All of us probably have friends and acquaintances that have been touched by this in one way or the other. And so when a family member is found to have coronavirus, obviously we want to the degree that we can, isolate. And I kind of, it's a little bit mean, but you want to isolate that person somewhere in your home, either physically, as much as possible, but staying 6 feet away from them, wiping down everything they touch, wearing masks at home, putting a mask on that individual for sure. And those are the things that we can do. It is absolutely not inevitable for someone to get the virus if they're at home with somebody else and caring for them. And let's talk about what caring for them looks like. Some people will have a very mild case, a cold or a flu type of a case. Others get very, very sick. And people have talked about, taking a deep breath to keep your lungs clear. And a lot of people are talking about the severe muscle aches and pains that we get with a flu, but it can be much more severe with this. And obviously there's a small population, luckily in Utah it's smaller than the national average, of people that are having to come into the hospital to get care. And we've seen that in some of our public figures, both in the state and outside. And so it can vary quite a bit. But no matter what that looks like, that doesn't mean if I have the virus and you're at home with me, it doesn't mean that you're going to get it. Definitely not inevitable.